Hi, today I'd like to talk about renal denervation therapy. This is a relatively new and novel form of treatment for hypertension. As I've alluded before in my previous videos about the different drug therapy treatment that's available for patients with hypertension, unfortunately not everyone would respond adequately to drug therapy alone. There are some patients who will still have resistant blood pressure, high blood pressure despite taking drugs. Hence, this is an alternative therapy to help reduce the blood pressure in a non-pharmacological manner. Now, what is renal denervation? Renal denervation is basically a catheter-based therapy. It's an invasive form of treatment where catheter or tube is placed in the renal arteries. It's done under local anesthesia. It's similar to an angiogram or angioplasty where a sheath or catheter is placed in the groin through the femoral artery, where the catheter is then passed and placed inside the renal arteries. And through that, radiofrequency ablation is carried out to burn away renal artery nerves located in the wall of the renal arteries. So basically, renal denervation is a form of radiofrequency ablation. The concept behind it is the fact that renal arteries supplied by sympathetic nerves, and these sympathetic nerves are responsible for the autoregulation of blood pressure. And it's been shown in the 1950s, if you slice up or you cut these nerves, you can reduce blood pressure. But that's a surgical form of treatment, very invasive form where you open up surgically and cut these nerves. So this technology has been developed as a way of cutting these nerves in a non-surgical manner through a minimally invasive approach. It's radiofrequency ablation through a catheter that's placed through the artery in the groin. Unlike angioplasty procedure where a stent is placed, in this case there won't be any device that's left behind. So it's a fairly safe procedure. The catheter is passed and it has multiple microelectrodes placed in a circular or spiral fashion around the renal arteries, and multiple radiofrequency ablations emitted during each pulse, lasting usually a minute. And after several ablations, the catheter is placed from one kidney to the next, left side and the right side, and then it's removed. Procedure is often completed within half an hour under local anesthesia. It has minimal side effects or minimal risk to it. Of course, being an invasive procedure, there's of course the risk of bleeding or hematoma in the groin side, but there has been no evidence of any major long-term risk. The theoretical risk of renal artery damage has not been shown in the trials. Some patients do experience a bit of pain in the loins from the ablation procedure, but this is only transient. So it's a fairly safe procedure, and it's been shown to be very effective in a couple of trials that have been conducted last year. It's been presented, has shown that this therapy does reduce your blood pressure, systolic blood pressure, up to 6 to 10 millimeters of mercury. And as we know, if you reduce the blood pressure by more than 10 millimeters of mercury, you reduce your risk of a heart attack or stroke by 10 to 20%. So it's an effective treatment in terms of reducing blood pressure, and there are the benefits of reducing your cardiovascular risk with this form of treatment.
Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share and comment. Thank you.